I'm Dr. T and welcome to my office. So today I'd like to look at pharmacology from the point of view of a biochemist. So, okay, what are we doing? So pharmacology, of course, is trying to make chemicals or pharmaceuticals, hence the name, that, when put in a human, or in theory something else, but typically we're a little bit more Homo sapien centric here, when put in a human, makes the human better for whatever better might be. Relieves pain, kills bacteria, whatever, is wrong, makes it better is the goal. Well, the way this happens, generally speaking, as a biochemist, when I'm looking at this, what I'm really thinking about is, okay, so there is something wrong with human. I want to adjust a protein. There is some protein that its function is not optimal. This could be something like the proteins assembling the cell wall of bacteria. It's not optimal because I want those bacteria dead because it's an infection. So I will find a molecule that can inhibit those and by doing so kill the bacteria. Or, hey, my stomach's got too much acid in it, so I want it to stop producing as much acid. So I'll find an inhibitor to the proton pumps that are pumping in the acid into the stomach. And of course that would be like Pepsid AC. These proteins are going to be what we call drug targets. They're something that we want to adjust their functioning. Typically it's going to be inhibiting, but not always. If you look at, say, capsaicin, its drug target is a temperature sensing protein that is telling your body, oh no, I'm on fire. I'm receiving such a high temperature that damage is being ensued. So this is the protein that when you put your hand on the stove is telling you, move now. And what capsaicin does is it binds to that protein and recalibrates the temperature at which it goes, oh no, I'm on fire, and then lowers that down to the point where it's like less than body temperature. So it's like, my mouth's on fire after eating this chicken wing. Alternatively, you've got things like opiates, which are binding receptors that normally exist in the brain for other functions, but by triggering those, you then basically hack the brain. Which, in certain circumstances is useful, and in other circumstances is absolutely horrible, and at epidemic proportions within certain parts of society. So, two-edged sword. One case study I'd like to look at is one of the oldest pharmaceuticals out there. Precursors of this would date back to antiquity. And in fact, spawns a whole family of pharmaceuticals. And by family, I mean a bunch of chemicals that are different chemicals, but they all basically have the same drug target. They're doing the same thing, just slightly differently. And this old pharmaceutical? Aspirin. Actually, I should say acetylsalicylic acid. Aspirin is the brand name and also a case study in trademark law and how to lose it. Because so many people use the word aspirin to mean acetylsalicylic acid, not just acetylsalicylic acid produced by the Bayer Chemical Company. That Bayer lost their trademark. Poor Bayer. But let's look at this drug. So this one actually exists since antiquity. Several plants produce salicylic acid, which is a relatively small molecule, and they'll have it flowing around their sap, and that can be used as an analgesic, a painkiller, as well as several other functions. The way it does this, its drug target are the COX enzymes. And these are part of a pathway where your body takes arachidonic acid, which is an omega-6 fatty acid, and then through a whole boatload of steps, but in the middle of which involves the COX enzyme, and there's a couple of versions of COX, and he does this and oxidizes it and turns it into a host of molecules called prostaglandins. Prostaglandins are these communicating molecules. Their job is to go, we've got a problem. There is damage, let's inflame, and the goal here is to, one, make it hurt so you are aware that there's a problem. Pain is very much like the smoke detector. You know there is something wrong when it's going off. Now, also like the smoke detector, you quite often want to go, shut up, I got it, I'm just cooking. And of course, we want to shut down that pain. But this also has other areas where it's trying to, warm up, maybe fight infections, a couple other biological responses, of which, if going unchecked and just keep going and going and going, actually can cause collateral damage. So, you don't want your sprinklers going off for no apparent reason in your house, or once the fire's out, you want the sprinklers to go off. And so it's kind of the scenario where we want to take inflammation and make it go away. Well, the goal here with aspirin and really the entire family called the non-steroidal anti-inflammatory drugs is to interact with typically the COX enzyme, but interact in this pathway. So this family is going to be looking at this pathway, very focused on the COX enzyme, but not exclusively. And trying to stop this so we can turn off the inflammation. The actual way that aspirin works is not entirely understood. It's pretty much assumed that once it gets in you, it turns into salicylic acid. The salicylic acid is kind of the active component, and that is going to be an inhibitor to the COX enzyme. However, it's a fairly harsh chemical. That's why aspirin is a thing. It's a much less harsh pharmaceutical, which you're thinking, man, aspirin's hard on you. Yeah, salicylic acid is even worse. Now, that said, we've got newer drugs out there for a reason kind of scenario. So yeah, that is aspirin. We're making an inhibitor to an enzyme that's in a pathway that triggers inflammation. By inhibiting the enzyme, you inhibit the whole pathway, you cut back the inflammation, which is presumably what you're wanting to do because you hurt yourself. You're going to take it easy. You need the pain to go away so you can get on with the rest of your life kind of scenario. So with that said, have a wonderful day, and I will see you in other videos.